Welcome to your PEBT skill building lessons. We are glad to have you join us. This is the sixth in a series of learning opportunities, some self-directed, like this one, and others through Zoom or in-person sessions. Today's skill building session will help you develop the knowledge and skills needed to perform the duties of a PEBT benefits administrator effectively. In this lesson, we will focus on the district's role in the Joint Early Intervention Services, or JEIS as we like to call it. Following this lesson, you will be able to explain the purpose and function of the JEIS program to a member, describe the district's specific responsibilities within the JEIS process, submit timely referrals, and coordinate with union representatives, the healthcare management specialist, the member, and other service providers as appropriate. JEIS is a proactive service designed to support unionized support staff during absence and help them return to work safely and as early as possible. It focuses on early recovery and return to work support, ongoing connection, successful return to work outcomes, and transition to LTD when required. It all happens through a joint effort between the employer, the union, healthcare management specialist, and the member. How you support employees during an absence directly impacts your operations. You keep your qualified, trained staff working, which results in less of a negative impact on operations and costs. Timely use of JEIS helps employees return to work sooner, reducing the risk of long-term disability, and keeps your workforce supported and connected. JEIS supports regular unionized support staff who have completed 3 months of employment and are working 15 or more hours per week. It also includes regular employees in temporary assignments, but not casual staff. JEIS is a partnership. Your district plays a critical role alongside the union and the healthcare management specialist, or HCMS. The school district has 3 roles: an absence advisor, a management representative, and a district JEIS coordinator. The absence advisor submits referrals and provides basic information to the healthcare management specialist. The management representative promotes JEIS and supports workplace accommodations. The JEIS coordinator helps coordinate communication and support. Partnering with the union is also your responsibility. It is important to advise the union of the JEIS referral, as they will connect with the member before the HCMS makes contact. Early union involvement is critical. It helps build trust with the member, increases participation in JEIS, and improves the chances of a successful return to work. The union plays a key role, including contacting and advising members, promoting and educating on the program, acting as a liaison, and participating in the JEIS committee. The insurance provider has healthcare management specialists, or HCMS, who work with you, the member, and the committee. Your district is also part of the District JEIS Committee, which helps improve the program. The best way to support a member during an absence is to stay connected. Your District JEIS Committee should meet with the HCMS regularly and collaborate to support employees returning to work when applicable. More detailed information on the district's roles and responsibilities within the JEIS program can be found on the website under Joint Early Intervention Services and then select Roles and Responsibilities. You will get stronger return to work outcomes if you do the following. Submit referrals by day 6 of absence. Notify the union at the time of referral. Maintain regular supportive contact with employees. Start planning return to work early rather than waiting for a full recovery. Collaborate closely with the union and HCMS, and share concerns early with the union and HCMS. Let's check in on your learning. Who is eligible for the JEIS program? A. Unionized support staff who have completed 3 months of employment, work 15 hours a week, and are regular employees, including those on temporary assignment. Or B. Unionized support staff who have completed 3 months of employment, work 15 hours a week, and are regular employees, including casuals and those on temporary assignment. The answer is A. Unionized support staff who have completed 3 months of employment, work 15 hours a week, and are regular employees, including regular employees on temporary assignment. Casual staff are not eligible. JEIS is a partnership with whom? A. The district, PEBT, and Pacific Blue Cross. B. The district, the union, and the healthcare management specialist. Or C. The district, the union, and hub. The answer is B. The district, the union, and the healthcare management specialist, or HCMS, to ensure members are supported. Referral should be submitted by day 6 of absence. Earlier is even better if you know the absence will continue longer than 6 days. This is because we know that the sooner someone receives support, the sooner they are likely to return to work. Referral forms are available on our website on step 1 of the JEIS referral toolkit and should be sent to age_groups_ENG@desjardins.com. It is very important to provide an accurate effective date of coverage, which is the Members Corps LTD eligibility start date after 3 months of active employment. This date will be important if the employee applies for long-term disability benefits. Provide additional information in the comments section to assist the HCMS in providing appropriate, compassionate support, such as a recent loss or trauma, accident, surgery, or hospitalization, return to work plans, and any workplace conflicts or leave status. Providing clear, relevant information in the referral helps the HCMS understand the situation quickly and provide the right support sooner. You can follow the steps in the JEIS referral toolkit available on our website. Stay connected. Simple check-ins by phone, email, or text help members feel supported and reduce isolation. Aim to connect regularly based on the member's preference. How you communicate matters. A supportive, respectful approach improves the member's experience, and better experiences lead to better outcomes. Don't wait for full recovery. Start thinking about return to work early. Explore modified or alternate duties and identify any barriers ahead of time. A proactive approach keeps momentum going and increases the likelihood of a timely and sustainable return. There are plenty of practical tools available to support you and your members. You can find videos and posters to share with the members on our website. Educating them about JEIS before they need it will help with engagement when they need the services. You can also find resources to support you on the website, including the JEIS Referral Toolkit, the Return to Work Toolkit, step-by-step guides and templates. These are all designed to make your role easier and improve outcomes. Let's check in on your learning. When do referrals need to be submitted? A, after 2 weeks away, B, by day 6, or C, before their sick leave expires. The answer is B, by day 6, because we know early intervention helps people return to work. What is the benefit of being proactive? A, members are more likely to return to work. B, members receive needed supports and benefits. Or C, you are getting a head start on your work. The answer is A and B. Members are more likely to return to work, which is better for the district, and the members receive needed supports and benefits, which is a benefit for them. Congratulations, you have just completed the 6th in a series of skill-building lessons. You can now explain the purpose and function of the JEIS program to a member. Describe the district's specific responsibilities within the JEIS process. Submit timely referrals, and coordinate with union representatives, the healthcare management specialist, the member, and other service providers as appropriate. You can find more self-directed skill-building modules on the PEBT website.